Welcome to One-on-One. I'm Steve Adubato. We are pleased to welcome. He's been in the insurance industry for a few years, and he's back. He's Bob Meehan, and he is the Chief Executive Officer of Health Republic Insurance of New Jersey. Good to see you, Bob.
It's good to see you, Steve.
You've seen a few things in the health insurance industry, huh?
Yeah, things keep going around, though, like everything else in life, but yeah, it's been a while.
Describe Health Republic for people who do not know what it is.
Sure. Under the Affordable Care Act, or as some people know it as Obamacare, there was a provision that started co-ops. They were championed by a U.S. Senator from North Dakota who was familiar with the co-op concept for farmers. And because there were very few new entrants in the healthcare insurance space in most states, New Jersey is a good example of that, the law funded a bunch of these not-for-profit cooperative insurance companies.
23 originally.
23 originally, with the intent that by the third year of operation, the board of directors would be majority composed of actual customers, members.
Today, of the 23 original co-ops established, how many are left?
11 are left.
And your company's one of them?
We're one of the survivors, and we're proud of it. We feel pretty good about what we've been able to accomplish.
Describe the original growth. When you started out, it's about 4,000 members?
Yeah, and we got a lot of criticism for that. Only 4,000 members. People had greater expectations. Turned out to be serendipitous because Congress in the intervening time cut back funding. So some of the cooperatives who priced their product very aggressively got caught short when funding for one of the safety net protections called the risk corridor pretty much evaporated. And we didn't need that protection because we only had 4,000 members.
And today?
Today, we finished the year at 55,000 members. After open enrollment, we think we're going to come in around 45,000, which is a good thing.
Why?
Well, one of the things we found is that this is an incredible number. 60% of Americans who are in the exchange nationally.
Let's explain the exchange.
It's the health insurance exchange.
You go on and you purchase insurance.
If you're an individual
exchange
and you can't get insurance through your employer or Medicaid or Medicare, you can buy on the internet or through an 800 number, but most people are buying through the internet.
Healthcare.gov.
Healthcare.gov. And depending on your income.
Put it up. I'm sorry for interrupting. Team,
Sure.
Let's put it up on the screen. The healthcare.gov site for people who are just looking for information. Go ahead.
Sure. So for people who fit certain income eligibility requirements, the federal government will pay a sliding scale of the premium, which is a great deal for people. Some people can come away with out-of-pocket cost of as little as $40 a month for a pretty good health insurance plan. The issue nationally, though, was that this risk corridor was supposed to support companies who took on a lot of membership, and ultimately the government said they could only pay 12.6 cents on the dollar. That really caught a lot of companies short, but because we only had 4,000 members, it really was immaterial for us.
But take a step back. I mean, again, you've seen a lot of these changes over the years, Bob, with your experience in this industry. The pros and cons of the Affordable Care Act, otherwise known as Obamacare, how do you see it?
I think there's both pros and cons. One of the obvious pros is it's made insurance available to millions of people who otherwise would not have access to it because insurance is expensive. Close to, depending on the state, 70 to 80% of the people are getting a premium credit from the federal government. And arguably, the majority of those people would not be able to afford the insurance without some premium help. Most states, including New Jersey, expanded Medicaid for adults who did not have children.
Good thing.
That good thing added millions. Are there things that should have been done in the Affordable Care Act? Yes. A lot of us in the industry think there could have been more focus on helping consumers understand value.
What does that mean?
Well,
give me an example of that.
Well,
because a lot of people watching this right now are saying, I am confused. It's confusing.
One of the classic examples is that the doctor says to you, Steve, you have a family history of colon cancer. It's time for a colonoscopy. You have no idea whether the hospital or facility you're using is really the best or the worst. You may not even know what it's going to cost. If you have a high deductible plan, you know it might cost, well, actually colonoscopies under the Affordable Care Act for preventive screening should be free. But still, back to the value thing, do you really know whether you're going to the best provider or somebody who's just okay? Value information is, there's not a whole lot of transparency. Yet we expect the health insurance market to work like buying cars, where there's a consumer's guide. And you can figure out that, sure, I'm willing to pay for a luxury car, but I know I'm getting value for it. That's hard to say.
But Bob, respectfully, and full disclosure, you're one of our underwriters, as let's just say some of the bigger folks in your industry are as well. And you know them because you used to work for that particularly large company as well. But I got to say this, when the Affordable Care Act was put out there, it was said that it would be like purchasing, oh, you know, they didn't say like a car. Jen Eichlin helped me on this, our executive producer. Didn't they say it would be like going on, if you wanted to do a trip, what's it called? Like
Travelocity?
Travelocity. Yeah, like you'd go and you'd say, hey, I don't want to take this flight, I want to take this flight, like booking a flight. So you made it just sound like it's not that easy.
Well, it is easy to buy, but to find out the value, no way.
But on a flight, I could figure out the value, no?
Well,
I don't want to get into the aviation, that's a whole other issue, but are you saying it's not that simple?
Well, think about this. If you want to fly from Newark to Orlando,
yes,
chances are that you're going to be on a Boeing 737, whether you fly Delta, United, or JetBlue.
right.
So that seat in 21A is pretty much the same experience, whether you're in JetBlue. And so now the difference is whether it's $230 round trip or $400.
I can make that decision.
Now,
how about on health insurance?
Now you go to health insurance and you say, well, wait a second, and here's what consumers aren't doing right now, which is, I think, is a good message. People are buying based on the price of the policy. They're not looking at deductibles or coinsurance or copays. Some of them aren't even looking to see whether their doctor is in the network. For some consumers, that's not important. Hey, if you're 30 years old and you don't have a history, any health issues,
no big
then
deal.
Maybe low price is what you want to avoid the tax penalty.
But most of us, those things matter.
Especially if you're over a certain age. And it looks like both of us are.
Yeah.
Whatever that mystical age
stuff.
is. You absolutely have to look at that. And it's not just about the price of the policy. Now you're into, can I go to the hospital that I'm comfortable with? The hospital that's in my neighborhood?
That's right.
Or are they going to make me jump in my car and drive 30 miles or more to get to a hospital that's in network?
Two quick questions before I let you out of here. One, best advice for consumers out there trying to make sense of all this?
Well, healthcare.gov has some interesting stuff, but I would encourage them to look beyond the price, look for the amount of cost sharing that they're going to be asked to absorb, but take the time, if they have health issues, to make sure their doctor, assuming they have a doctor that they're comfortable with, and if there's a hospital they've had a positive experience with, by all means, make sure those providers are in that program. There are also websites on the internet where you can get some entry level, if you will, quality information.
One more quickie. Number one leadership lesson, I've been asking leaders of all stripes this question. Number one leadership lesson you have learned in your few years in the industry is?
Treat the people who serve the customers well, and they will treat your customers well.
Well said. I want to thank Bob Meehan, who is the Chief Executive Officer of Health Republic Insurance in New Jersey, for joining us and trying to make sense of a pretty complicated situation. Thanks, Bob. Stay right there.
You're welcome, Steve.
We'll be right back right after this.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by the Healthcare Foundation of New Jersey, TD Bank, the New Jersey Education Association, PSE&G, New Jersey Sharing Network, NJM, and by the Russell Berry Foundation. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.